I had my hands resting on my stomach, and the provider needed to apply pressure there. They grabbed my wrists and put my hands on the table.
So I called a nurse line to explain my concern, and the nurse laughed at me. She laughed. It turned out it was the beginning of preeclampsia.
As providers, we all want our patients to have the best care and experience possible. Understanding what trauma-informed care is and how to provide it is one way we can make sure that happens. Trauma is defined as an event or circumstance that someone experiences as being physically or emotionally harmful or life-threatening that will have a lasting effect on their functioning or well-being. We can think of trauma as something that overwhelms a person's ability to cope. Using this lens, we see how deeply personal trauma is. Ultimately, how someone experiences an event determines if it is traumatic or not. This is why something that is traumatic for one person may not be for another. When we think about it this way, we can see how common trauma is. It is likely that most of the patients we care for have experienced some type of trauma.
I had to keep telling my story each time a new person came in to provide care. It was horrible having to relive it over and over.
To be honest, I'm not ashamed or shy about my diagnosis, but I feel like that's the only thing they saw about me, and all of my care sort of started to center around this one thing about me.
Trauma-informed care is a whole-person approach to healthcare that acknowledges the impact of trauma on health and is inherently patient-centered. It's care that seeks to create physical and emotional safety for those who have experienced trauma and rebuild their sense of control and empowerment. It also emphasizes the need to resist re-traumatization, as well as the creation of new trauma through the healthcare experience. As providers, we don't need patients to disclose their past traumas to provide trauma-informed care. Patients don't owe us that disclosure. We can do our work to realize the widespread impact of trauma, recognize the signs and symptoms, respond to this by integrating knowledge about trauma into policies, procedures, and practices, and actively resist re-traumatizing patients. Ultimately, using trauma-informed care as a universal approach benefits all people, not just those with a known history of trauma. Knowing how common trauma is and the importance of trauma-informed care for all, how do providers put it into practice? There are 6 key principles commonly recognized as part of trauma-informed care. It's not a checklist, but you can think of each as a piece to an overall approach. The first principle is safety. After a traumatic experience, safety can be difficult to regain for many people. In practice, both physical and psychological safety must be considered throughout an organization. Some things are obvious, like a well-lit parking garage or bed rails in a hospital. Some things are more subtle, like not positioning yourself in front of a door in an exam room. Safety should include everyone, including staff as well as patients. The next principle is trust and transparency. This means that decisions of providers or administrators are made with transparency and with the goal of building and maintaining trust with patients or within the organization. One way to put this into practice in patient care is during history taking. You can explain why you may be collecting certain sensitive information before asking. The third principle is peer support. Peers are those who have shared experiences, who can support healing by using their stories and lived experience. Peer support is part of establishing safety, building trust, and enhancing collaboration. An example of peer support might be peer counseling as part of treatment for substance use disorder, or support groups for those dealing with infertility or loss of an infant. It can also mean prioritizing and supporting time for teams to debrief after a poor clinical outcome. Collaboration is the next key principle. A main goal of a trauma-informed approach is the leveling of power differences between providers and patients. This can be achieved through shared decision-making, providing patients with their options and assisting them in making their own informed decisions about their care. While the provider is the expert in medicine, the patient is the expert in their own lives and priorities. The best care plan needs to incorporate both perspectives. The fifth key principle is empowerment. Empowerment depends on the belief in the importance of and the resilience of the people served, as well as the belief in the ability of individuals and communities to heal and promote recovery from trauma. Shared decision-making, providing choices, and goal setting when developing care plans are all ways in which patients can feel empowered. The last key principle is having awareness and knowledge of cultural, historical, and gender-related issues and their impact. This approach acknowledges that trauma may be experienced due to actions taken against people because of their gender, sexual orientation, or racial and ethnic identities. Avoiding cultural stereotypes and biases, offering access to gender-responsive services, leveraging the healing value of traditional cultural connections, and recognizing and addressing historical trauma are all ways to enact this principle. Especially within healthcare, we have to own our history of doing harm and acknowledge that consciously or unconsciously, for many of our patients, that history and associated mistrust enters the room with us. Again, trauma-informed care is not about ticking boxes next to these principles. It's an understanding that everyone, regardless of their trauma history, benefits from a whole-person approach to providing care. These principles are not directives. Part of what makes care trauma-informed is that it honors everyone's uniqueness, which means that there is no one way or script of how to provide trauma-informed care. The principles are there as a compass to help guide us in our practice.
You know, I have to say that when the provider took just a few extra minutes to explain all of the options to me, I felt much less anxious about it. I think that even helped me listen more and better understand how to take the medications that we chose. I'm not sure I would have done that if I was still so anxious.
When my provider learned that I was a survivor of sexual assault and anxious about the exam, he took the time to ask me what I needed and ended up connecting me with a female provider who took over my care. I'm not sure that I could have gone through with the exam or that I would have ever gone back had he not helped.
Ultimately, moving to a trauma-informed approach calls for a paradigm shift. Instead of approaching someone with the question, "What is wrong with you?" a trauma-informed approach asks instead, "What happened to you?" This simple shift is a powerful way to start. Providers and staff at every level can begin by asking themselves, what can I do in my role? What would implementing trauma-informed practices look like for my organization? By embracing trauma-informed care, we can create a safe and compassionate environment for healing and growth. We have an opportunity and responsibility to make trauma-informed care the standard practice within healthcare and human services. We can work together to promote healing, resilience, and well-being for individuals, systems, and communities.